In order to raise awareness and engage stakeholders on the ground to make them understand the ill effects of tobacco, and we have with us some of the officials and the spokesperson of health department. They are going to tell us about how this program is going to shape up in the future and how stakeholders are going to be engaged. And today you had a media sensitization workshop. Tell us something about this program and tell us your name also.
Dr. Mir Mushtaq, I'm State Nodal Officer, Kashmir Tobacco Control Program. Today we had arranged a media sensitization workshop about the National Tobacco Control Program. Because we understand that the media has a very important role to play in disseminating the information about the control programs and about the awareness which people need to know about the ill effects of the tobacco. So that's why we had called the media, of the local media and national media as well, here to disseminate that information to them so that they can percolate that downline to the masses, and our message about tobacco control reaches out to each and every individual.
But we have seen Jammu and Kashmir, despite being the smoking capital of India, we have seen a lot of things are not implemented on ground. You still see these cigarettes being sold outside schools. You still see there are few so-called ambassadors, promoting and flaunting smoking hookahs and all. There are hookah bars coming up in different parts of city. What is the health department going to do on this?
Yes, if you could see our workshop today, that was the theme, actually, the cornerstone of that discussions were based on the challenges which we are facing in implementation of the National Tobacco Control Program. As you rightly said, that the new things are emerging out, like the hookah bars, and then the outside schools, educational institutions, people selling cigarettes and selling it to even teenagers. We had recently a national youth campaign was launched on World No Tobacco Day. Under that campaign, we had series of programs in the educational institutions, universities, and other educational institutions, and that has really given a very sound message about the ill effects of tobacco and what measures we need to do. And you rightly said that we were seeing a violation of certain sections of the Kotpa, but that's why we are here working together in tandem with the government, with police, with the educational department, trying to reach out to the people and face this challenge. It's a huge challenge. As you rightly said, J&K is the sixth biggest consumer of tobacco products, and that's a huge challenge for a small state like us, that we have to come out. But having said that, there's a visible change on ground. If you could see, the public place smoking has definitely come down. You will agree with me that in the olden days, you used to see people used to smoke in the buses, public transport, at public places. That has definitely come down. That means the messaging is going down to the ground level, and there is a change.
There's a culture of smoking in Kashmir. I mean, when you go to village, you'll find these older men, older people sitting on these, banks of the rivers. You'll find them on the dukans, shops, smoking hookahs. How are you going to, percolate this message, and how are you going to control this? And tell us your name also first.
Okay, myself, Dr. Maria. Regarding, you are asking about the prevalence of these in the shops, and I think the first and primary step is awareness generation among the masses. Like we are doing awareness programs across the villages at block level. It should, and enforcement is very important, from block to district to state level. That is also, and first point is awareness generation. Second is enforcement of Kotpa, which is the most important step, I think.
I would like to add Dr. Maria's comment. I'm Dr. Mohammed Nasir. I'm a state program coordinator from the union working with the government of Jammu and Kashmir. Recently, we have launched the Tobacco Free Village campaign. The motive was that awareness should be taken down to the line. We have noticed that awareness program has remained up to cities only. It was not reaching to the village level. So we have launched on 31st May 2023. Our Secretary Sir has launched the Tobacco Free Village campaign. Through that, we'll take the messages to the down line. And recently, I got news from Anantnag that they have declared some 4 or 5 villages as tobacco-free villages, and that's a good sign. That means our ground workers are working, our districts are working at the village level. They are sensitizing people about the tobacco hazards, because we believe tobacco should be controlled, because it leads to the further drug consumption.
Dr. Mishtak, do you think declaring any zone as a tobacco-free zone? Do you think it's just declaring the zone as free? Do you think it's making any difference on the ground?
Yeah, you see, look, messaging does help. We are running a control program, not an elimination program.
Okay.
We're not claiming that we are going to eliminate tobacco. What is our success is going to be that if 20 people in a village are smoking, if after 3 years after our campaigning, declaring the village smoke free, if only 10 are smoking, that means it's a success of our program. We're not claiming that we are going to, make that village entirely tobacco free and nobody's going to smoke. No, that's not the purpose of declaring some village as a tobacco free. What we understand is that we are focusing on that village. We are making that village as a symbol for the other villages to take home that message and see how that village is working. In that particular village, we want to see that no shopkeeper is actually selling the cigarettes. There is no shop around the schools, education of that village where the cigarettes are, being sold. We want to make accessibility, availability, and of course the affordability, difficult for the people.
Difficult for the
Yes,
consumers.
yes.
Are you going to carry out any survey on this?
Yes, we have a program of a survey, and we are talking with the Government Medical College Department of Social and Preventive Medicine, and we are very soon going to have a survey in Kashmir, whole UT of Jammu and Kashmir, about the prevalence and the implementation of the code in the UT.
So do we have a data like how much cigarettes are being
Yes.
consumed in?
Yes, we have the Gates 2 survey, Global Adult Tobacco Survey, which has been conducted in 2017, the last survey which has been conducted. And according to that survey only, we are saying that the J&K is the 6th largest consumer of tobacco products in whole country after the Northeast. So ours is a big challenge. And we have around 25% of the population who are actually using some form of the tobacco. So particularly in Kashmir division, if you see, we have very high prevalence as compared to the Jammu as well. So the challenge is bigger here, but we are hopeful that if there is right messaging, there is we holistically take it up. The society plays its part, the religious leaders play its part, the media plays its part, police department, education department. It's a multi-sectorial problem. It's not limited to health department as only. So we all have to join hands together to come out and to face the challenge.
We have also seen surge in lung cancers in Kashmir. Lung cancer is one of the top, it tops the list of top 10 cancers in Kashmir. I think after esophagus and stomach cancers. Are you going to engage the premier healthcare institutions also like SCIMS or Government Medical College Srinagar for doing extensive research on this?
Obviously, see, the program is not limited to the health department only. We have a responsibility of reaching out to each and every institution, whether it's a tertiary care institution, it's an educational institution, it's a health institution. Our messaging has to go to everywhere. Recently, we had a program in the Kashmir University, and we have declared the campus as tobacco free. So, likewise, we will reach out to every nook and corner of the valley, be it education institution, health institution, and obviously our tertiary care, institutions can play a very important part as far as the research is concerned.
Maria, this health department also identified some ambassadors.
Yes, we have identified.
Has it helped the department to send out the message?
Yes,
louder?
it has helped the department to a greater extent in spreading the message. We have selected the ambassadors on World No Tobacco Day during the launch of Tobacco Free Youth campaign, and this campaign has really turned into success. Like as per the reports of Ministry of Health and Family Welfare, we are at the top position in the country for in the implementation of toffee guidelines and conducting the challans. Like we are among the fifth. We are at the 5th position in the country for conducting the challans and for the generation of revenue.
Yeah, I would like to add. See, the purpose of our making out the ambassadors was just to, there are some people who are looked upon by the society, the role models. Like we had Sri Shahid Chaudhary ji is a noted figure, and then we had Dr. Sushil Razdan. He's also a household name in the Kashmir Valley, and our national hero. Parvez Rasool was an international cricketer. We wanted to involve them just to, for the messaging purpose, so that their involvement in our programs can, positive elements and make youth to be a part of this challenge. See, we visited so many schools, colleges, and we have seen a lot of excitement in the children, particularly the female children. We went to women's colleges. The girls were really excited about it and working with us to make a change.
So lastly, I just want to ask this question. There's a drug menace is rampant in Kashmir, and I think it's also one of the factors for that. Uh, how is health department working? Because you are also spokesperson of the health department. How is health department working on that?
See, as you could hear, or what the secretary sir in his address today said, कि, drug addiction, precursor to drug addiction is the cigarette smoking. So it works as a gateway to drug addiction. And we have seen those whosoever is a drug addict initially has started with the smoke. So he starts with the smoking and then he leads it to the government of Jammu and Kashmir has been very, very serious under the leadership of Sri Bhupendra Kumar ji. The department has been very serious about the drug addiction. We have created addiction treatment facility centers almost in every district. Then the sensitization programs, the counseling is being done, and in collaboration with the NIMANS here in Kashmir, a lot of programs, a lot of activities are happening, and we are seeing a visible change. I think in few years down the line, you might see a positive change here. So we'll wrap up with this. We hope that we see a positive change on the ground, and with this, the stakeholders are saying that government is very serious to bring different transition as far as the smoking in Jammu and Kashmir is concerned. Thank you so much, Dr. Saab. Thank you.